When is an MSLT recommended for sleep apnea patients? Imagine waking up feeling tired even after a full night of sleep. That can be frustrating, especially if sleep apnea is part of the picture. The multiple sleep latency test, or MSLT, is a special test that helps figure out why someone might still feel sleepy during the day. But when is it actually used for sleep apnea patients? Most of the time, the first step in diagnosing sleep apnea is an overnight sleep study called a polysomnography. This test records brain activity, breathing, heart rate, and other signals while you sleep. It helps doctors see if you have sleep apnea and how severe it is. The MSLT is not usually part of this initial process. Instead, it is used after the sleep study if doctors need more information. The main reason to do an MSLT is if a person still feels excessively sleepy during the day even after their sleep apnea has been treated. For example, if someone uses a continuous positive airway pressure machine but still feels very tired, the doctor might suggest an MSLT. This helps check if there is another sleep disorder, like narcolepsy or idiopathic hypersomnia, causing the sleepiness. Another situation is if the initial sleep study shows no significant sleep apnea, but the person still reports daytime sleepiness. In that case, the MSLT can help find out if a different condition is behind their tiredness. It measures how quickly someone falls asleep during several short naps taken during the day. If they fall asleep very fast or enter REM sleep during these naps, it can point to other sleep issues. Doctors usually recommend the MSLT after they have done an overnight sleep study and have started treatment for sleep apnea. If the treatment is working and the person no longer feels sleepy, the test might not be needed. But if sleepiness persists, the MSLT can give important clues. In summary, the MSLT is a follow-up test used to explore unexplained daytime sleepiness in sleep apnea patients. It helps determine if another sleep disorder is present or if the sleep apnea treatment needs adjustment. It is not a primary test for diagnosing sleep apnea itself, but a helpful tool when more answers are needed about sleepiness.